Hello everyone, my name is Mark Gabriel D. Marquez. I am 24 years old, a fourth-year medical student, and my major concern are my acne scars that I get from my previous breakouts in doing late-night reviews in the medical profession. And now I'm in CSA to try a new trend, a machine that can help me remove these acne scars. And don't forget to hit the subscribe button and the notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. Just for a disclosure, this video is not being paid by the producer or the distributor or the manufacturer of the material or the product or machine that we are using in the video. Okay, for today's episode, we will be demonstrating the multi-injection technique using our skin boosters for the treatment of acne marks or acne scars, as well as open large pores. Today, let's welcome back Dr. Mark Marquez. Hi, Doc.
Hello po, Dr.
Yeah, so it's been like how many years from the last time we had a treatment?
It was been 2 years, I think.
Yeah,
2 years.
it's the time of the pandemic, right?
Pandemic, yes.
And plus, Dr. Mark is in med school, so still doing the online schooling?
Yes,
Okay.
Unfortunately.
Yeah, and of course, during that time, there were restrictions in coming out, and you cannot even go back to your regular treatment with us.
Yes.
And because of that, okay, so Doc Mark, having this medical studying, plus this, I think lack of sleep also because of a lot of works in the
Yes po, due to
in
the
front of online schooling of computers, or even if you're just at home, I feel like you still have a lot of things to read and to study, right? So leading to the pores, too much of a stress, triggering the acne formation and the acne leaving acne marks.
Acne marks.
Okay. Plus of course the skin, the oiliness, or sebum production, and then the skin pores, okay, enlargement of the skin pores, and then some of the blemishes from the acne. So those are the concerns of Dr. Mark right now. So we wanted to do a treatment, of course, something that's still non-surgical and non-invasive as much as possible. And we wanted the treatment with as much as possible, again, no downtime, or should we say minimal downtime. And something that's very effective also.
Yes.
And very safe, clinically proven safe. Okay, so ideally when we manage initially the acne problem, we give some anti-acne medication to control inflamed acne. Okay, and then after that we also treat the marks. We have a treatment modality that will directly target those scarring or those blemishes from the pimple. So we have a new device today, Doc. It's exciting because we have a new treatment modality again that we will be using for you, okay? And it's something that will also help restore your skin's nourishment, at the same time regenerate collagen, okay, which we also need, okay? They say that aging starts at 25. How young are you, Mark?
Yes. Statistically, yes.
How young are you? Still?
24, but
oh, you'll be 25 na.
Yes.
So another thing is to also prevent the aging. So this is also a type of prevention. Okay.
Yes.
Prevention of lines, wrinkles, and then the sagginess. Okay. Yes. So, do you have any question on that?
Any questions? None, but
None.
I'm very excited for this.
So what kind of treatment is that? And we will show you when CSA Medical Aesthetics return. And we're back, everyone. So we'll be doing a procedure for Dr. Mark that will target the pimple marks or blemishes and also at the same time improve some of the beginning fine lines on the forehead region. So for our procedure, we have the so-called air dissector with the multi-needle injection method, whereby we can deliver essential skin nutrients and even amino acids or even medications that we can inject into the dermis of our skin. And this will improve, for example, fine lines or wrinkles, acne marks or acne scars, or even those large open pores, or those with concerns of blemishes or pigmentations, through which, via a method of delivering whitening solutions, like for example, our tranexamic, our vitamin C into the dermis of our skin. So for now, for Dr. Mark, we'll be working on the forehead region and also in the mid-face region, so the cheek area, and then part of the lower face area. Okay, and in our center, we have right now the so-called pain freeze spray, whereby this will be our way of numbing the skin before doing any treatments, specifically for those with injection methods. So, Doc Mark, so right now we have this, it's a topical anesthetic skin coolant. So this will give us an analgesic effect or something to reduce or control any pain or discomfort. Right, Doc Mark? So at least we'll make it somehow painless. Okay? So this is pain freeze here. It's a spray onto the skin. So we'll just be spraying. So we will spray it onto the forehead region right now. So it has a cooling sensation. Okay? Then immediately after, we can do our air dissector treatment. So I'll be working on the fine lines over the forehead region, or some of the pimple marks, or also target those large open pores. Okay, so we just need our assistant to press directly onto the brow region. Just gentle, girls. Okay, just a little bit here, and then we'll be stepping on the foot pedal there, and then just there. Okay, there you go. And there's a little bit. Okay, so there's an instant elevation of the skin layer. Okay, so it's very good for those deep skin furrows or deep static lines. And one more there. Okay. Are you good, Doc Mark?
It only tickles mo daw.
It tickles? Okay, that's a good sensation. A tickling sensation. So after that, we'll proceed to the right side of the face. Okay, we can spray the coolant again. So we will spray the coolant on the right side of our face, of Dr. Mark's face. There you go. And then we'll be pressing onto the skin. I need the OS here. I'll just do the pressing. Okay. And then we'll be targeting the skin part here. There you go. So it's like creating also skin blebs. And the purpose is to separate dermal layers so that when we deliver the medications, they are in the right plane, in the right layer of the skin. There you go. There's an instant lifting effect. Okay, part here and there. For those asking, like, what is the interval for the treatment? For air dissection, we can repeat this every 2 to 3 weeks. There you go. Now, let's go to the other side of the face. Are you still okay, Dr. Mark?
All well and fine, Madam.
Okay. So, they're spraying again the skin coolant. It's a cryo spray. And I'll work on the left side, pressing onto the skin layer here. So, I'll just direct the needle like that. So, it's an easy technique, easy procedure. And very superficial only. So, instant lifting there. Almost. There you go. And then, okay. So, we have done the dissection, skin or air dissection. We'll proceed to our multi-needle injections to deliver our micronutrients for the dermis layer of the skin. So we will proceed to our multi-needle injection method, and this one has this multi-pins here, or the needle part here. So this is attached to a 3 cc syringe of our skin booster solutions placed on our handpiece here. And then this kind of multi-needle tip is a single use only. So we replace it for every client of ours. So one use only, one client only for this one. Okay, so it has 9 pins there, and then it has like up to a 3mm depth, which is the right depth to deliver our skin nutrients. We can also deliver hyaluronic acids, amino acids, vitamins, peptides, minerals, and even our lightening solutions. Okay, so the procedure for this one, so we'll start at the forehead region, and then just a direct skin contact. So you can still spray the skin coolant. So the skin coolant actually gives an instant analgesic effect. So like few seconds only, it's cold and there's gonna be a numbing effect already. Okay, so just a direct skin contact there. So you will hear that sound, and then we can push the button there. Okay, 0, 1, 2, 3, and then we can pull the skin. Actually, it has a strong vacuuming effect. You're good, Dr. Mark?
Yes, po.
Okay. Yeah. Spray again. So you can just keep on spraying the Vapo coolant. Okay. A topical anesthetic spray. Okay, it's a spray for the comfort of our client. Okay. Then there's the needle again. There you go. The suctioning effect. And then pushing the 9 pins. There you go. So there's already a noticeable, like the mark from the 9 pins there. So we're just delivering our skin micronutrients. I'm using specifically an Oriole brand which has multiple ingredients inside them. Again, they have amino acids, peptides, vitamins, minerals, and other very helpful natural growth factor peptides. Ang dami nun, Doc! Diba? Beneficial talaga for the skin regeneration, or the collagen synthesis, elastin synthesis, and the restoration of our natural hyaluronic, so that those pitted marks or pimple marks, they will be repaired again, so they will regenerate from within. Okay, so this is very effective in specifically managing those acne scars or sunken marks, or even those deep static lines. And then if you compare it with the laser devices, the laser microneedling which we used before for Dr. Mark, that one has also microneedles, multiple pins, but it delivers a laser energy at the tip of the needle. This one delivers micronutrients or solutions to target those inner layers of our skin, because we always apply topicals but they just stay on the surface. They don't really totally penetrate the inside layer, and this is the best way to deliver those important skin nutrients into the inner part of our skin. So it's gonna be very effective. Okay, Doc? Again, we're continuing. Spray again. So you just can continue doing it so that when our patient is like having the treatment, there will still be a continuous numbing on our skin. Okay. And then press. Okay. Doc, you're feeling a little bit, or somehow you're feeling that the 9 pins, or
I can't even feel if there are even 9 pins.
oh, okay.
I feel the numbness more of the
Yeah, the coolant is really very helpful. So for our patients who are afraid of needles, this is already a solution. So no more fear for those tiny needles. So we can still spray here. Actually, the others are no longer applying topical numbing cream when they have this kind of spray. There you go. So it's really very effective in giving that analgesic effect. So for all the injection procedures, we make use of that coolant already. So there are some areas, Doc Mark, that's sensitive, right? That somehow you can feel it, but somehow it's very tolerable. Okay, I'll just proceed on the upper area here. So there's like an interval of few seconds for every treatment. So this is a better way of injecting or delivering skin boosters into the skin rather than doing those other napage techniques or meso injection techniques like a single needle injections. This one is already 9 micro needle. There you go. Okay, so we'll proceed to the right side of the face, and again we'll spray our coolant. It's an instant numbing effect. So whenever I do my injections already, I make use of that device or that spray, analgesic spray. So I still have like a 3 cc of my solution, my skin booster solution to deliver. So the acne problems of Doc Mark were like concentrated more on the cheek or mid-face and a bit on the lower face. Right, Doc?
Yes, nafe-feel ko lang halos just as yung suction lang eh.
Suction, right?
Yung needles din yun eh.
So we'll just keep on doing this. Okay. So we'll move to the opposite side. We're nearing the end of our treatment. Yan, very good. So this is the pain freeze together with our multi-needle injection method for treating our acne scars, pimple marks, large pores. So stimulating collagen regeneration, improving our skin texture, as well as preventing the signs of aging. So other benefits would include skin brightening, lightening, aside from the anti-aging benefits and the acne scar management. Okay, so there's an extension of the marks here. So I'll be doing last 2 and the final one here, And there you go. So after doing this kinds of techniques, we'll still give like a highlight to hasten the recovery of the skin and also reduce the redness, and apply a ProLab cream for our post-procedure care. And then we'll show the result to Dr. Mark when CSA Medical Aesthetics return. And we're back. So we have done the air dissection as well as multi-needle injection method for the acne scar management and also prevention of the signs of aging. So we'll just show to Dr. Mark the appearance of his skin right now. So here's our mirror, Doc. Okay, check lang po. Okay. So it's expected to have some of this like blebs, tiny blebs, or a blanch, what do you call this? A blanching effect from the air dissection, which is temporary, and also some redness there, and tiny, or rather like a minimal swelling only. Okay, so we will also do highlight for Doc Mark, and we will be applying a post-procedure cream that will hasten the recovery of the skin. Usually when we do that, just within the day, the redness and the swelling will already clear up. And then actually when we were doing the pain freeze, I noticed compared with those clients whom we did the procedure that we do not apply this, there's more of erythema or redness. For Dr. Mark, so this is the post-procedure, the immediate post-procedure. So less, actually I could say less of the redness as compared to those without this one. So I will ask Dr. Mark how was the experience and what is his comment on the use of our pain freeze while we were doing the multi-needle injections. Doc Mark.
The pain freeze is really good because at first you will feel that really cool sensation. It's very cold, like it almost feels like you're putting ice on your skin. But then after applying that coolant or the pain freeze and applying the needles, you won't feel the needles at all. I only felt the suctioning of the device, but the needles, I don't feel any of the needles. I can't even count how many needles were there. And then I recommend this also. This is also good for people who have allergy with the lidocaine cream. Yes.
Yeah, exactly.
And it has a very fast application wherein if you want to apply it early on, like if you're in a hurry to have this treatment done, you can have this applied and use here in the CSA.
Yeah, that's correct. Because some of our clients are always in a hurry. Like for example, they want to do injection of, like for example, Botox or fillers. And they don't want to wait for the 45-minute or 1-hour lidocaine cream application effect. So this is already a solution for that. We can spray it because instantly it's gonna be numb already. Plus those people with allergies to lidocaine cream, because I have some clients when we apply the topical numbing cream, they have this redness and reaction already. So this is our remedy for that one. And even other procedures, we can make use of this. And even the warts removal, which is very painful, we can make use of this. And other even medical procedures like when we lance boils, or even like we do vaccination, you can just spray it on your skin, or even intravenous injections. Yes. And then with the multi-needle injection method that we have done, it really helped very much in, of course, reducing pain. So those who are afraid of needles, we already have a remedy. You won't even feel the needle tip of your whatever method we are doing or whatever treatment we are doing. Okay, and so far with the management of the acne marks. So actually right now I'm seeing that like all of a sudden the redness is already becoming less and less. And if we still further do the highlight therapy plus the application of the ProLab cream, it's gonna be the normal skin color already. Now the tiny blebs, yung parang bump, yung tiny bumps from the air dissection, in a little while it's also gonna clear up. So the pinkish color of the skin will also be, or it will come back in a little while. Okay, so thanks Dr. Mark.
Thank you, Doc.
Yes, thanks to our viewers. If you have further questions, you may email us at csaskinclinic@yahoo.com. We also have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. By the way, Doc, are you, or will you allow our viewers to ask some questions about the procedure? About the procedure only, okay? Some would want to ask any social media account that they will just ask, Doc Mark, masakit ba? Something like that.
Of course, you may ask questions about the procedures from me and also my personal experience about it at my IG or my Facebook account. Just type Mark Gabriel D. Marquez and you will find it there.
Yan. And wala mo ng konsulta. Okay. There you
Wala
go.
mo na konsulta.
Yes, there you go. Okay. So our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9190 or 0917-5044-268. Our clinic hours are from Mondays to Saturdays, 9 a.m. to 5 p.m. And again, this is not a paid video or film by the manufacturer of the machine and the products that we are using. So when it comes to natural beauty, you can trust the CSA Medical Aesthetics.